So far, thanks to the incredible work of NHS colleagues and the shared sacrifice of everyone who's at home, that plan is working. The latest figures show 3,260 spare critical care beds across the NHS. On the most recent figures, there have been 763,387 tests for coronavirus so far in the UK, including 43,453 yesterday. 161,145 people have tested positive, an increase of 3,996. 15,796 people are currently in hospital with coronavirus. 21,678 have now sadly died in hospital, an increase of 586 since yesterday. This morning, the Office for National Statistics and the CQC published more information on the overall impact, including that there have been 4,343 notified deaths in care homes since Easter. The proportion of coronavirus deaths in care homes is around a sixth of the total, which is just below what we see in normal times. I want to make sure that we bring as much transparency as possible to important information like this. And so from tomorrow, we'll be publishing not just the number of deaths in hospital each day, but the number of deaths in care homes and in the community too. This is something that wasn't previously possible. This will supplement the ONS and CQC weekly publication and all add to our understanding of how this virus is spreading day by day, and it'll help inform the judgments that we make as we work to keep people safe. Today, because we've been able to expand capacity, I can expand access further. Building on successful pilots, we'll be rolling out testing of asymptomatic residents and staff in care homes in England and to patients and staff in the NHS. This will mean that anyone who is working or living in a care home will be able to get access to a test, whether they have symptoms or not. I'm determined to do everything I can to protect the most vulnerable. And we now have the capacity to go further still. So from now, we're making testing available to all over 65s and their households with symptoms, and to all workers who would have to leave home in order to go to work and members of their households, again, who have symptoms. I want to update you on our COVID-19 therapeutics work. This is research to understand whether existing drugs could be used to treat people more effectively once they've developed the disease. Currently, no drugs in the world have been clinically proven to treat COVID-19. But our therapeutics task force has identified a number of promising candidates. Currently, 6 different treatments have been entered into national clinical trials, and the first is ready to enter the next stage, a new early phase clinical trial platform that we're launching today. This is a national effort made possible by government, academia, and industry all working together. In addition, we have to make the best possible use of all the medicines that we have. We're updating the guidelines for the use of medicines in care homes, removing a barrier so that for the period of the pandemic, where it's clinically appropriate, medicines that have been labelled for use by one patient can be used by another patient who needs them instead of being destroyed. Clinicians and colleagues in social care have called for this change, and it's already standard procedure in hospitals. Right across government, we're working day and night to defeat this virus. Ramping up testing capacity, investigating new drugs and treatments, backing vaccine development, securing and distributing billions of items of PPE, getting the NHS whatever resources it needs to make sure that it is always there to treat everybody who needs it. The risk of a second peak is real, but as a nation, we're holding it at bay. So please, stay at home, protect the NHS, and save lives.